Imagine a virus, one that seems pretty harmless, really. Almost every single cat gets exposed to it at some point.
Yeah, for most of them, it's maybe a little stomach bug, nothing serious.
But then for a few unlucky cats, there's this. Like, this biological switch flips. That harmless virus mutates.
And it turns into something incredibly dangerous, often fatal. It's a dark secret hidden inside a common bug.
So how does that happen? How does something so common become so devastating?
Well, that paradox, that Jekyll and Hyde transformation, that's really what we're diving into today.
Right. Welcome, everyone, to our deep dive on feline infectious peritonitis, or FIP.
Our mission today is to really unpack this disease. It's complex. We'll look at where it comes from, why it's so hard to diagnose.
And crucially, the breakthroughs in treatment that are, really changing everything in feline medicine. Yeah. We're using your sources to get straight to the essential info.
Exactly. And it's quite a story. It starts decades back, with this illness that just baffled vets.
And now it leads us right up to today, with cutting-edge science offering real, tangible hope. It's pretty incredible.
It really is. Let's start from the beginning. FIP, the disease itself, was first described back in 1961.
Wow, that far back.
Yeah, by Dr. Jane Holdsworth, a real pioneer in cat medicine. But for years, it was just heartbreaking because vets couldn't really do anything effective.
So this Jekyll and Hyde thing.
Yeah.
It starts with something super common, you said. This feline enteric coronavirus.
That's the one. FIP is linked to feline coronavirus, FICO. But the key thing is almost all cats, especially kittens, get exposed to a specific form called feline enteric coronavirus, FECV.
Enteric meaning in the gut.
Exactly. And usually it's benign. If there are symptoms, it's typically just mild diarrhea, maybe nothing noticeable. Like 90% or more of cats with FECV are perfectly fine.
Okay, so a standard kitty bug for most, but then the dark twist you mentioned.
Right. In maybe 10% or fewer of those infected cats, something happens inside the cat. The FECV mutates. It changes.
Ah, so it's an internal event, not catching a worse version from another cat.
Precisely. This mutated form is what we call the FIP virus, or FIPV. It arises spontaneously within that individual cat.
And understanding that mutation, that's been a huge research focus, hasn't it? I know Dr. Gary Whitaker's lab at Cornell has done a lot here.
Absolutely pivotal work started around 2009, funded by the Cornell Feline Health Center. They're really digging into how that benign FECV turns nasty.
Because once it mutates,
yeah,
what happens then? How does it cause disease?
Once mutated, this virus isn't confined to the gut anymore. It manages to escape and infect the cat's own immune cells, specifically macrophages.
Okay.
And infecting those immune cells triggers this massive body-wide inflammatory reaction. It's the cat's immune system kind of overreacting, but in a destructive way.
So the inflammation is the real problem.
Yes, that systemic inflammation damages tissues, messes with organ function, and ultimately, without treatment, it leads to death. It goes from a minor gut issue to a systemic killer.
Wow. It really is like an internal betrayal.
Yeah.
So who's most likely to suffer this mutation? Is it random, or are some cats more prone?
It's not entirely random. FIP happens everywhere. Cats of all ages can get it, but it's definitely most common in younger cats.
Younger meaning?
Typically between, say, 3 months and 2 years old. Very young kittens, and also much older cats, maybe over 13, are also at higher risk. Their immune systems are either still developing or starting to decline.
Any breeds more susceptible?
There seems to be a predisposition in some purebreds. Abyssinians, Bengals, Burmans, Himalayans, Ragdolls, Devon Rexes. They pop up more often in studies. And interestingly, male cats seem to get it more than females.
Okay, age, breed, sex. What about their environment? Does living with lots of other cats make a difference?
Definitely. Cats in multi-cat homes, shelters, catteries, they're at higher risk, which makes sense when you think about how the original virus spreads.
Right. And stress, does that play a role?
Yes, stress is a big factor. Things like being rehomed, having surgery, or fighting off other infections can increase the chances of FIP developing in a cat carrying the coronavirus.
So let's clarify the transmission. How does the initial virus, the common FECV, actually spread between cats?
The main way is the fecal-oral route. So basically ingesting tiny particles of infected feces.
Which happens easily when they share litter boxes, I guess.
Exactly. Sharing litter boxes is prime territory, but it can also spread through saliva-shared food bowls, grooming each other, less often, maybe through sneezing.
And how many infected cats actually shed the virus?
About a third of them shed it in their feces. Most only shed for a few months, but a small number can actually become lifelong shedders.
How long does this virus survive outside the cat, like on surfaces?
It's actually pretty fragile in normal conditions, maybe 24 to 36 hours, but cold temperatures can keep it viable for months.
Yikes.
Yeah, and it can hang around on clothes or objects for maybe a few hours, long enough to potentially be carried between places.
Okay, this is crucial then. The original coronavirus is contagious.
Highly contagious, yes.
But FIP itself, the disease caused by the mutation, is generally not considered contagious from cat to cat, right?
That's the current understanding, yes. The mutation happens internally. But here's another tricky part. The virus, the original FECV, can lie dormant in a cat for months, even years, before FIP ever develops.
So a cat could seem perfectly healthy, maybe hasn't been near a sick cat recently, and still suddenly develop FIP.
Exactly. That latency period really complicates things for owners trying to understand where it came from.
And this complexity, it definitely carries over to the symptoms. They sound notoriously hard to spot initially. What are those first vague signs?
They can be really subtle. Things like just being off, listless, lethargic, maybe not eating as much, losing weight, sometimes a fever that comes and goes.
Nothing specific at all, really.
Not usually. In kittens, you might see poor growth or persistent diarrhea. But again, lots of things cause that in kittens.
So after those vague signs, the disease tends to split into two main forms, right? The wet form is more common.
Yes, the wet or effusive form. That's characterized by fluid building up in body cavities.
Like in the belly.
Yeah, if it's in the abdomen, the cat gets this swollen, pot-bellied look. If the fluid collects in the chest...
Breathing problems.
Right, difficulty breathing. This happens because the virus damages blood vessels, causing inflammation and leakage.
Okay. And the other form, the dry form, that sounds almost sneakier.
It can be. Dry or non-effusive FIP involves very little or no fluid. Instead, you get severe inflammation within organs.
Which organs? Could it be anything?
Pretty much. You might see eye problems, ocular signs. Sometimes it's the only thing you see initially.
Just eye inflammation.
Yeah, or it could affect the brain, causing seizures, maybe wobbly movements, balance issues. The liver can be involved, leading to jaundice, that yellow in color. Kidneys, lungs, intestines, any of those can be affected.
So signs could be neurological, or maybe just drinking and peeing more, or vomiting.
Exactly. Dry FIP can look like a lot of different things depending on which organs are inflamed.
And whichever form it takes, historically, the progression was pretty relentless without treatment.
Tragically, yes. The symptoms tended to get worse and worse. Without effective treatment, most cats, they deteriorated rapidly. Euthanasia was often the kindest option within weeks, maybe a few months for the dry form. Cats with wet FIP often went downhill in just a couple of weeks.
Just devastating. Which leads us straight into why diagnosis is such a nightmare for vets. It's known as one of the hardest calls to make.
It really is. It's because the disease is so complex, the symptoms are nonspecific, as we said.
Mimicking lots of other things.
Exactly. And the tests. Well, the tests have major limitations. Here's the absolute ticker. Conventional tests cannot tell the difference between the harmless, common FECV and the deadly, mutated FIP.
Still, even now, no single blood test.
No single lab test can reliably distinguish them. Antibody tests just show exposure to a coronavirus, not necessarily the FIP-causing one. They can't be used alone for diagnosis.
What about PCR tests? They usually find specific viral genetic material, don't they?
They can detect coronavirus RNA, yes. But so far, no unique genetic sequence has been found that is only present in the FIP virus and not the enteric one. Some labs claim they can distinguish them.
But that's disputed.
Yeah, many independent experts aren't convinced by those claims yet. So, practically speaking, a positive PCR in a healthy cat doesn't mean much for FIP risk. And a negative PCR in a sick cat doesn't rule FIP out. It's frustrating.
So how on earth do vets diagnose it then? What do they use?
They have to build a case, essentially. Look for a combination of clues.
Like putting puzzle pieces together.
Exactly. They look at the cat's history, age, breed, environment. They look at the clinical signs we discussed. Then blood work abnormalities are often suggestive things like low lymphocytes, high neutrophils, really high protein levels, maybe jaundice.
And if there's fluid, like in the wet form?
Analyzing that fluid is incredibly helpful. FIP fluid is typically thick, yellow, and very high in protein. That's a strong indicator. Imaging like X-rays or ultrasound can confirm the fluid.
Are there more specialized tests?
Yes, though they might be less common or more invasive. There's something called immunoperoxidase staining, which can detect virus-infected white blood cells in fluid or tissue samples.
So,
And tissue biopsies looking for characteristic inflammation under the microscope are often considered the most definitive way, but sometimes that's only done post-mortem, unfortunately.
and for neurological signs.
An MRI can be very useful. It can show distinctive changes in the brain or spinal cord that are typical of FIP.
So sometimes it really comes down to ruling everything else out first, that diagnosis of exclusion.
Often, yes. Vets might have to rule out cancer, other infections, inflammatory conditions, until FIP is the most likely explanation left. It can be a difficult and often expensive process for owners.
But there's hope on the horizon for diagnostics too. You mentioned Dr. Whitaker's work again.
Yes, that research at Cornell using advanced sequencing techniques is aiming to predict which specific viral variants are more likely to mutate and cause FIP.
Wow, imagine that. Looking at a kitten with diarrhea and being able to say, this one has a high-risk strain, we need to watch closely or intervene early.
That would be a massive leap forward. Early identification could lead to much better outcomes.
Which brings us perfectly to the treatment breakthroughs. Because for so long, this was basically hopeless.
Absolutely. Historically, it was considered almost 100% fatal. Like we said, weeks to maybe months was the expected survival time.
Before these new drugs, what could vets even offer? Just supportive care.
Pretty much. Things like corticosteroids, maybe other immunosuppressants to try and reduce the inflammation and make the cat feel a bit better for a while.
Like prednisolone.
Yes, prednisolone is common, maybe draining fluid if it was causing breathing problems or blood transfusions if they were anemic. But these were just palliative, easing symptoms, not fixing the underlying cause.
Okay, now for the really hopeful part. The part that reading the sources just felt like a miracle after decades of nothing. These new antivirals.
They truly are game changers. It's been a stunning development in veterinary medicine. We're talking mainly about GS441524, remdesivir, and also Molnupiravir.
And getting access to these, especially in the U.S., has been a whole saga, right? From like black market sources to now being legally available.
It has been an incredible journey. For years, owners were forced into this gray market online, but things changed. The UK and Australia legalized GS and remdesivir in 2021. Canada allows legal importation.
In the U.S.
In the U.S., remdesivir is legal but often hard to get hold of. But the massive news, the real turning point recently, is that GS441524 and Molnupiravir are now legally available through compounding pharmacies in the U.S.
Compounding pharmacies.
Yeah, thanks to a recent FDA decision allowing exceptions for these specific drugs for FIP. This is a complete turnaround. Vets can now prescribe them legally.
Oh, that is fantastic news for cat owners facing this.
Yeah.
So how do these treatments work? Is it pills, injections? How long?
It's typically a long course, usually daily treatment for 84 days, that's 12 weeks. It can be given as injections under the skin or, for some formulations, as oral tablets or liquids. Some newer studies are looking at maybe 42 days might be enough in some cases, but 84 days is still the standard protocol.
And the results?
Yeah.
Compared to that near 100% fatality rate before.
The results are honestly astounding. Cats often start showing improvement within days. The overall success rates are, studies show response rates up to 85%.
85%.
Yes, with maybe 85% surviving at least the first 6 months post-treatment. It's flipped the prognosis completely on its head, from almost certain death to a very real chance of survival and cure.
That is just remarkable. It really highlights the power of targeted antiviral research.
It absolutely does, and it underscores how vital early treatment is. The sooner you can start these antivirals after a diagnosis,
the faster you can shut down that damaging immune response.
Exactly. It dramatically increases the odds of success. Getting that diagnosis and starting treatment quickly is key.
So it's an amazing success story, but it's not quite a simple cure yet, is it? There are still challenges.
That's right. Even with these incredible drugs, the prognosis is still often described as guarded. The biggest issue is relapse.
Relapse, even after finishing the 84 days.
Yes. Up to half of treated cats might experience a relapse, either during the treatment course itself or, more commonly, sometime after they stop the medication.
Wow, up to half. That's significant.
It is. It means owners and vets need to remain vigilant. Also, cats that are already extremely sick when diagnosed with very advanced disease.
They might not respond even to these drugs.
Sadly, yes. Sometimes the organ damage is just too severe by the time treatment starts. And we also need more time. These drugs have only been widely legally available for a relatively short period.
So we need longer-term studies.
Exactly, to really understand the long-term effectiveness, potential side effects years down the line, and the true rate of lifelong cure versus relapse.
What about preventing FIP in the first place? Is there a vaccine?
There is a FIP vaccine available, an intranasal one. However, its effectiveness is pretty controversial and uncertain.
Why is that?
Mostly because of how complex the disease development is, the mutation aspect. The main veterinary bodies, like the American Association of Feline Practitioners Vaccine Advisory Panel, do not currently recommend it for general use.
So if the vaccine isn't really the answer, what is the best way to try and prevent FIP? Is it about preventing the initial coronavirus infection?
That's the main strategy, yes. Try to minimize exposure to and shedding of the common feline enteric coronavirus.
How do you do that?
Good general health helps. Meticulous litter box hygiene is really important. Scooping frequently, disinfecting regularly, placing litter boxes far away from food and water dishes.
And avoiding crowding.
Definitely. Overcrowding increases stress and the concentration of the virus in the environment. Keeping numbers manageable, like maybe a max of 3 cats per room in multi-cat situations, can help reduce the risk, but...
It's no guarantee.
No, unfortunately. Even with the best practices, you can't eliminate the risk entirely because the virus is so common and the mutation is an internal event.
Okay. Well, we have certainly taken a deep dive today into FIP. It's gone from this almost mythical, universally fatal disease to something where we now have real effective weapons thanks to some incredible science. It's a story of hope, truly.
It really is. But as we've discussed, diagnosis is still tricky, requires careful work by vets.
And that risk of relapse means it's not over once the treatment course finishes. Ongoing monitoring is important.
So the key takeaway for anyone listening, if you're worried about your cat, if they're showing any signs, we talked about lethargy, weight loss, fever, belly swelling, neurological issues, eye changes.
Don't wait. Get them to your veterinarian promptly. Vets are much more aware now of FIP and these new treatment options.
Especially if there are neurological signs. Getting a referral to a veterinary neurologist quickly is a good idea. Definitely. Early action makes such a difference. The whole FIP story is just a powerful reminder, isn't it? That even when things look completely hopeless...
Dedicated research can completely change the game.
Exactly. It can turn despair into real, tangible hope.
It really makes you think.
Yeah.
What other conditions out there, things we currently think of as incurable in animals or even in humans? What's just waiting for that one key discovery to unlock a completely different future?